everyone, this is Dr. Justyna here from the Semiyama Wellness Center here in White Rock, South Surrey. I've been asked to speak to you today about the difference between food sensitivities and food allergies. Okay, so food allergies is what we've all typically heard of. It can come from an immediate reaction. So we eat a food like a peanut or we get stung by a bee and we immediately start to, develop a swollen tongue or swollen lymph nodes, break out in hives, that sort of thing. So that is caused when our immune system immediately reacts to something that we've eaten or something that's happened to us. Sometimes, we have to be rushed out to the hospital or we have an EpiPen. Of course, it doesn't always have to be that severe. It can be just as simple as a rash and some hives. So what is a food sensitivity or food intolerance? That is something that's definitely becoming more and more, heard of in today's society, especially since 80% of us, unfortunately, have food sensitivities or food intolerances. Seeing that the food that we're eating today has a lot of pesticides, herbicides, and it's just not as nutrient dense as it used to be. So basically, what are food sensitivities? So food sensitivities are delayed responses. It's our immune system that's triggered again, but it releases a different antibody to the food that we are consuming. And usually we don't have to notice symptoms until 2 to 4 days after we've actually eaten that food. So sometimes it can be difficult to pinpoint exactly what is causing it. Different symptoms that occur with food sensitivities can include everything from headaches, migraines, to fatigue, to of course the digestive issues, gas, bloating, some heartburn, diarrhea and constipation, of course. Other symptoms can include arthritis or swollen puffy eyes and black shiners, the black bags underneath our eyes, of course, and of course a bunch of other symptoms. So, how do you discover, or can you tell whether you have a food sensitivity? Well, there's 3 easy ways, of determining if you have one. One is to do a food elimination diet. That's something that you can easily do in your home. You just eliminate the top food sensitivities that you have. The most common ones are, of course, wheat and gluten, dairy, soy and corn, for example, and some of the nuts as well. So you take all those things out of your diet for about 3 weeks, and then you introduce one at a time back in and really monitor your symptoms. The other way of checking for your food sensitivities is to do a blood test. So you'd come into our office and we'd take a blood sample and send it off to a lab, and they would let us know what foods you're sensitive to. Typically they test, anywhere from 70 to 90 to 100 different foods. So that's nice and convenient. And of course the third way, which we do in our clinic at the Semiyama Wellness Center, is applied kinesiology or muscle testing to figure out what foods you're not reacting to well. So those are 3 different ways that you can try to figure that out. And of course, if you are suffering from any of these symptoms, or if you just want a general health checkup and really get your body and get your health and get your life to that next level, by all means feel free to contact us. We're here for you. Again, it was Dr. Justyna. I hope you learned something, and I look forward to teaching you more. Have a great day. Bye, everyone.